Hi, Dr. Tafur. How are you doing?
Pretty good. How are you doing?
I'm doing fantastic. I'm glad we finally got to connect.
Yeah.
Fantastic. So I wanted
Yeah,
to...
good.
Sorry, go ahead.
No, go ahead. That's it. Yeah, I'm
Uh,
listening.
so I wanted to give a brief overview to our audience about your background, and I know a little bit about your background. I was trying to do some more research, and I don't know if I'll be doing it justice. So maybe we can go through it
Yeah.
phase by phase.
Sure, that's okay with me. I don't think
Fantastic.
I have anything on LinkedIn. I don't think I have a bio on LinkedIn. I'm not really up to date with all that stuff.
Right, yeah. It's kind of
Yeah,
interesting.
I
There's so
should
many
be,
different
but
channels, right? There's a lot of...
exactly. It's
Yeah.
just like what,
Yeah, yeah.
Yeah, I can't figure it out.
So, Dr. Tafur, you're unique in that you have a conventional MD degree from University of California in San Diego.
That's right.
Tell us how you went from being a conventionally trained allopathic MD to finding Amazonian medicine. What turned you on to that, and why did you even seek that out?
Yeah, well, that's like my book is about that that's the journey. And it starts out with me getting depressed in medical school and feeling depressed for what it felt like the first time in my life, and struggling and trying to find some help. And my father was a psychiatrist, suggested I try some antidepressants, which I did, and found some benefit from that. But then I also was felt a little bit like I don't know, I'm a very sensitive person, and I felt like kind of funny little side effects. I was on Celexa, citalopram, an SSRI, and I felt like a little tension in my jaw that I had felt, trying ecstasy. I had tried it a couple times. And then I also felt a weird kind of thing in my periphery, kind of perception that kind of reminded me of feeling like mushrooms a little bit, which I had also just tried a few times. I wasn't really a drug enthusiast, but I had tried that stuff. And then at the same time, I had a colleague in medical school who was really excited about the new wave of psychedelic research. So he was kind of exposing me to a lot of the research that was just starting up after the DMT stuff that happened, and with Rick Strassman at University of New Mexico. I was in medical school from 1999 to 2003, so that was just on the scene. And he wanted to get involved in some psilocybin research, and did end up getting involved in some research that was going on in Switzerland. So I was reading, and I was beginning to learn about all this crossover biochemically between the psychedelics and the SSRIs. The Prozac was working on the serotonin system, and then the psychedelics are working on a certain aspect of the serotonin system, and that there was a lot of the psychedelic research was being focused on psychiatric problems like addiction and depression and anxiety and PTSD that, were a big focus of a lot of psychiatric medications. That a lot of people were using SSRIs for all those kind of problems. So then it just started breaking down the stigma for me about psychedelics. I was like, wow, seems very relevant. And then I was from Arizona. I'm from Arizona. And so I knew about peyote. And I was also very interested in something more natural, something, plant-based, kind of holistic and traditional. And so I decided to explore, ask around. There's a place here in Arizona, the Peyote Way Church of God, where they have opportunities to go through a ceremonial peyote ceremony. It's called the Spirit Walk. And I went through that, and I had a major healing from that process. And that's what really made me very, very curious about spiritual plant medicine. My family's from Colombia. I had heard about, ayahuasca and yahe, what they call yahe in Colombia is ayahuasca in Peru. And so then I just started becoming very, very curious about this kind of treatment or spiritual practice, because it was so revolutionary in my life. That really gave me the strength to complete medical school.
Wow. And did you ever practice conventional medicine, or do you ever find a reason to go that route?
I do. You know, I'm a licensed physician, and so I was when I left family medicine residency. I continued to work at urgent care and primary care in California, and then I started doing research. So I was doing part-time research and part-time doctoring, and I will continue to do that. And then in 2009. So in 2007 was the first time I went to Peru, but I stayed in research and working as a doctor in California. In 2009, I moved back to Arizona. My father had passed away, and so I got my license in Arizona, and I was working as a doctor here in family practice and primary care and some urgent care, and have been doing that ever since. You know, it was different. I was doing stints of time. I would work for 3 or 4 months as a doctor, and then I'd go down to Peru. You know, and that was the money that helped start the center that we started down there in Peru was from my work as a doctor. And also Spita is our other investor, my business partner there, Spita Bamic. So since then I, you know, since writing the book and all that, I've been doing some continued like per diem work, we call it, part-time work as a doctor, urgent care to kind of stay in practice. And then I'm getting involved in a integrative center in Phoenix right now called the Ocotillo Center for Integrative Medicine, which is like a joint practice with myself and a naturopath. So I'm still involved in being a doctor, yeah.
Okay, awesome. Couple of things. I think you mentioned your book, which is Fellowship of the River. Can you tell us a little bit about that? There were some really interesting insights that you had discussed in the process of writing the book. So can you tell us a little bit more about what inspired you?
Yeah, so the Fellowship of the River, it's called the Fellowship of the River, a medical doctor's exploration into traditional Amazonian plant medicine. So it kind of picks up me getting depressed in medical school and me going to peyote and having experiences there. And then moves forward to that leading to an interest in exploring ayahuasca in Peru and then going to Peru and having my first experiences there. And eventually leading groups down there and facilitating groups, and then teaming up with Spita, as I mentioned, and then a Shipibo healer, Ricardo Maringo, and starting our own center in Peru, and then treating people there, you know, for a number of years. So the book is following that chronology, and along the way, it's presenting cases, you know, of people that are going through treatment with ayahuasca and other master plants in Peru under a traditional Shipibo setting. And in presenting those cases is trying to make the argument, you know, for what, how can we bridge, you know, shamanic Amazonian medicine to modern medicine? And why are these people going all the way down there to Peru from America, from Europe, to get treated for problems that me as a doctor that I know very well, that we don't have very much success with, you know, in Western medicine, in Europe, in North America, and elsewhere. So why were these people coming all the way down there, and what could we learn from their process of healing down in Niue Rao? And so ultimately, that's what I've been going around talking a lot about, and why I'm trying to promote the book and encourage people to explore not necessarily ayahuasca plant medicine, but just the role of emotional healing. Just that this spiritual context of this traditional medicine appears to facilitate like a really profound, deep emotional healing for a lot of people. And that deep emotional healing ends up leading to a lot of measurable benefits in their physical and mental health. And so that's kind of like the thesis of the book. And I get a little more into the scientific theory of like, well, what is this energy spiritual healing work doing for them at the physical level? And, you know, I at least open the discussion that maybe it's acting at an epigenetic level. It would make sense. There's a lot of science and reason to think that. And so that kind of thinking builds on other people's work and other people's ideas has led to this research project we're doing right now to explore that, you know, very same question with the MAPS MDMA research with PTSD. So they're seeing people are going to the MAPS MDMA-Assisted Psychotherapy trial, for treatment-resistant PTSD, the people entering that trial have had an average of 17 years of treatment-resistant PTSD, and then, the majority of them are having a really dramatic shift in their symptoms after a 12-week intervention that involves 2 or 3 MDMA sessions. So this is like a really dramatic turnaround. Like the 68% of them that say at 1-year follow-up no longer meet criteria for PTSD. So that's really groundbreaking, and it's related to the kind of things that I saw down in Peru with what could be called a psychedelic assisted therapy, which is traditional Amazonian shamanism. And so we're going to do research right now through our nonprofit Modern Spirit, where we're collecting saliva samples on the people going through that trial to try to see if, like, the ideas that I was inspired and the insights from the book and partially inspired by ayahuasca, that maybe how some of this deep emotional and spiritual healing is happening is through encouraging epigenetic changes that allow people to overcome trauma from their past. And so, we're going to move into the lab analysis phase of that study in the next few months. And maybe one day we'll conduct similar research with ayahuasca. But the basic bottom line is that the reason people go down there is because they're looking for a medical system that is going to acknowledge, as I say, the emotional and spiritual dimensions of their illness, And once that happens for some of these people, that makes a really, really big difference. So one of the cases I present, for example, in the book, is a guy with Crohn's disease, inflammatory bowel disease. So he has really severe Crohn's. He has a painful, bloody stools every day. He's got a lot of severe abdominal pain, a lot of diarrhea, regular, problem all day, every day. And he's had 2 surgeries, has had 2 bowel resections. They removed pieces of his intestines twice. And has been, in and out of whatever treatment for that for a really long time. And then after a few weeks in the Amazon, a process that he went through there, he had a dramatic reduction of the symptoms, like no further abdominal pain, no diarrhea, no blood in his stool, and only minimal discomfort for the next year. So how do you explain that? And then if you look into what he went through, his personal experience and his process, it was about a huge release of trauma and resolution and reconciliation of some repressed trauma of sexual abuse that he was unaware of and later confirmed through family connections, and also kind of getting over a lot of issues with a violent stepfather and a father that abandoned him. Like, sorting through all those issues was apparently key to him getting over also this concurrent depression, that wasn't really getting acknowledged by his gastrointestinal doctors, that he was nearly suicidal. And yet, all the research around that disease, Crohn's disease, we know that it has comorbidity, that it is commonly associated with anxiety and depression. And when you see this inflammatory bowel disease and the Crohn's disease and ulcerative colitis and irritable bowel syndrome as a step towards that, maybe there's emotional trauma there that needs to get worked out. And the reason I make a big deal about it, and people might try to say, oh, that's woo-woo or whatever they want to downplay it, is for the care of those individuals. It's like, well, guess what? They're spending thousands of dollars on immunosuppressive drugs and occasionally going to surgery, hospitalization, all this other stuff. And now the economic, expenditure towards that problem is minimal. He takes a little medical marijuana when he has some, stress and his guts start acting up, and that's it. So, as far as the society is concerned and conservative kind of ideas, well, economically, it was a great move for him and for the Canadian healthcare system where he, participates. So it's just it's the reason why it's important is because it may be really a key thing to alleviate people's suffering physically and mentally, is to really understand how their emotional biology is affected by trauma, and then identifying therapies and interventions that are effective in addressing like deep underlying emotional trauma. And it turns out that in some cases, or many, where the research is growing, but ayahuasca-related practices, done in the right way, with the right preparation and the proper conditions and screening and care, that, it could be really impressive in addressing emotional trauma. And similarly, that's what we're seeing with Mdma-Assisted psychotherapy. That's looking like very, very impressive in what it's doing and allowing people to make shifts over a period of weeks or months that they had not made in years.
Now, as a healer, do you have any insight? It seems like our culture doesn't acknowledge things that we cannot see with the naked eye, right? So you may see a chronic pain patient, but a lot of times people will say very insensitive things like, oh, that's in your head and that's not real. But to that patient, it's very real, and their body is riddled from the effects of that. Do you have any insight to why our culture views things that way?
Yeah, well, that's the opening line to my book, is that, have you ever gone to the doctor and they told you it's all in your head? That's exactly it. And it's because there's a major issue around in our culture, in our society, and I would say, like, for many reasons, the over-materialistic, the over-industrialized, the over-corporatized, working towards whatever, being rich and having it all together and looking great. And so there's really in the lack of spirituality, in the sense that there is a lack of spaces where people can be vulnerable, like legitimately vulnerable. And that turns out to be extremely important in working out like emotional trauma and healing at that level. You need to be like allowed and cared for, to be cared for in a vulnerable state where you are safe, from judgment. And so that doesn't really exist, apparently, in academia, or in a lot of corporate settings. There isn't a place for people to open up and really be a human. And so since those leaders are under that kind of scrutiny where they don't get a chance to release like that, well, then they don't really facilitate that happening outside either, So there's a cultural kind of like insecurity around what would happen if people saw me fall apart, which is like, it's really like unfortunate because everyone's going to fall apart, and so it doesn't make any sense. And then the problem is it like leads to a lot of health issues and health problems. So let's say in the case of fibromyalgia, like you mentioned, or chronic pain, where, I would say that it's highly likely that there's a lot of like emotional trauma contributing to those kind of problems. And that's a very real situation. And so then they work so hard to try to find measurable changes in muscle fibers and fibromyalgia so people can prove, this is really happening to me. And that's okay. They're trying to characterize this thing that's happening to a lot of people, but because no one wants to talk about, they're so worried about the visible, the measurable aspect, that they don't talk about this other aspect that is maybe not so easy to measure, but there are forms of measuring it, which is just what is the emotional burden of this person? Is depression real? Depression is based on questionnaires. Like if they didn't measure your serotonin levels or whatever's going on in your brain, would you still accept that person might actually be depressed or not feel well? Is anxiety real? Is PTSD Is that real? You know? So my thing is like, as far as the invisible's influence in our life, it's as real as heartache. It's as real as joy. And it's as real as PTSD. So, you know, it's really just, it gets to a point where it's just kind of sad, you know, that it's just, I get it. And so we have to have compassion for these people who are not ready to acknowledge this vulnerable reality of being a human being. But that, of course, your subjective experience has a major influence in your life. Like that's only a fool would say that's not true. Just because you can't measure it, well, it doesn't mean you need to be a fool, you know? And so it's trying, so I mean, I don't want to be aggressive, but it gets aggressive sometimes because you're trying to defend something for these people. And the bottom line is it's like they just need more compassion to allow these people, these leaders, to go through that kind of healing process. You know, and I regularly have, like, we've had big academics come through the center in Peru. You know, we had somebody who was the head of surgery at one of the major, you know, medical institutions in the United States, and they didn't tell me until the end. You know, they were just so embarrassed. They were just so terrified that they would somehow be outed or exposed, you know, for struggling with, you know, their life. And the person is a very decent person, you know, who, when you get to know them and what they went through, it's a horrific tragedy. And so it's just the real thing of the problem is, you know, this is a great movie. I think it's a great movie. It's a little slow, but I think it gets going, and it's you know, it's so awesome. So I encourage people to try to get through it and watch it. It's called From Shock to Awe. And it's about, you know, yeah, so it's the vets, you know, American vets, combat vets, like high-level soldiers who are, you know, really struggling, suicidal, you know, going to the VA and getting prescribed. They show the opening of the film is them opening their medicine cabinets, and they're showing them 80 different meds, you know, that they've been prescribed over the past 2 years, and they hate all of them, and they don't think any of them are helping. And then they start smoking marijuana, and they're able to control their symptoms to a degree. And then now they want to go deeper, and they explore with ayahuasca. And then a couple of these guys have really, really major experiences. And this guy says, you know, when they're thinking about, you know, coming from families where there's multiple generation soldiers, you know, the father, the grandfather, et cetera, so where many people feel like maybe it's their obligation to live this kind of life for the family, to be an American, to be American. And then they realize, oh my God, I don't want my child to go through this. And my kids. And one of them just, he says, I just realized that our society has become such a repository for trauma. It's just untapped trauma. It's just trauma on trauma on trauma on trauma on this war to that war to this war to that war to all the rest of it. And no role for like deep healing. Because no one that's not even around, aren't even in touch with that. Like, so then when we see this kind of healing that happens at the MAPS trial for at least a few people, you know, we're still learning more. Or what I've seen with a few people or hundreds of people in Peru, you're just like, oh my God, we didn't know that was possible. We thought you were just screwed. You know, if something like that happens to you, you're not ever going to get better. You know, if you're heavily sexually abused, you know, the doctors, psychologists, I don't know. A lot of them, maybe they're not going to be so hopeful about your case. You know, you have a heavy addiction problem, you know, maybe not so much, you know. You got a heavy PTSD problem from Vietnam, you know, 50 years ago. I don't think we're going to get anywhere with this guy, you know. So then what kind of healing does penetrate those kind of problems? And so that's what we've been, unfortunately, that kind of healing requires a very vulnerable process, you know. It's not going to happen in an hour. It's not going to happen in 10 minutes. And it's going to be difficult, and it's going to be very uncomfortable. but it could also end up being very, very beautiful. But it requires a lot of support. It requires a lot of open-mindedness and a real lack of judgment. So there ends up having to be a little bit of some sort of spiritual context, some sort of mystical access to people being open to being genuinely open to like a universal love that's going to help them, guide them through that process,
Is there ever a situation where, as an MD, you don't recommend for a person to follow a path toward Amazonian medicine?
Yes, many situations. So the first obvious situations are when people have a history of bipolar and manic episodes. Ayahuasca can definitely push people into severe mania, problematic mania. People with history of psychotic episodes and schizophrenia can be pushed into psychosis and really problematic psychosis. People who have cardiovascular risks, that they've had heart disease or they might have a stroke, could definitely have an episode like that during an intense, ayahuasca ceremony, for example. And then you get into medication interactions. So ayahuasca is kind of a complex pharmacology. So you have to be concerned about any possible medication that they might be on. That needs to be double checked and screened in. And then you also have the reality that these people have to be able to integrate the experience, And so some people who are just a little too fragile, they don't have the proper support, and they may not be able to properly integrate the experience. So some kind of assessment around their stability and their ability to integrate. So those are the things that I think about, when people ask me if it might be something for them to consider.
Right. Now, if someone wanted to explore this option for them, is there any way that they can reach you? Is that something that you work with, or is there any recommendations that you might have?
Yeah, well, I would say that they should, if they're, it's illegal. I'm a medical doctor in the United States, and currently illegal ayahuasca. There's 2 churches that have, religious exemption to work with ayahuasca, and there's a growing number of people who are trying to see if maybe they can, and I'm interested in that, in getting exemption for, using ayahuasca as part of a spiritual practice. And, that also would involve spiritual healing and could be involved in helping people. So that's kind of just coming along in the United States. That's still a ways off. So there are a number of places internationally, in Costa Rica, in Peru, and elsewhere, where people are going, to go through ayahuasca ceremony in a safe place with, advanced practitioners who are serious and not trying to rip them off or want to abuse people further, which also goes on. So yeah, I don't have time to address everybody's concern on the internet and everything like that. That's the issue. So there's a number of resources. Like in Peru, there's iAdvisor, and there's iSeers has an organization in Europe. There's Chacruna is a website and an organization coming out of California. They provide a lot of material to guide people around the process. Reality Sandwich just did an article. You're doing your stuff, So I think there's a lot of resources. Those are the resources that I guide people to right now is chacruna.net and iSeers.org. And in Peru, people can consider iAdvisor or taking a look at some of the different centers.
I think that's great information. And sometimes I hear people ordering ayahuasca on the internet and just doing it on their own. And I feel like that gives me so much fear as a health educator.
It's not recommended.
It's
not recommended. People do that. People are going to do that. We can't stop people from doing things like that. But it's not recommended in the traditional culture, where people have a lot of experience with ayahuasca for multiple generations. They're very cautious with ayahuasca. They do not So, eventually the advanced practitioner, they use it on their own, sure. But after they've been through a lot of experience and training, and so that's the way we see it. There's a lot of people think, oh, that doesn't matter. You don't need a shaman, all that stuff. But I would say in the case of ayahuasca versus some of the other substances, it's definitely more advisable that you have guidance and somebody watching over you.
Now, you mentioned a lot about tracking epigenetic changes. There was a point in the book that I believe that one of your patients kind of gave you some inspiration to look in that direction. Can you tell us how you first thought about it? And can you actually maybe explain what epigenetic changes are?
Yes. So I, I tell this story a lot, but I'm happy to share it because it's the foundation of my interest in this topic. And, we have a crowd fund. We're trying to spread the news. We have a crowd fund because the research we're doing with MAPS is funded by the crowd fund, and we need more money. And it's on modernspirit.org for anyone interested, and you can learn more there about epigenetics and the study. But how I got into it was that epigenetics, first of all, is the study of the way genes are basically regulated, like in response to the environment. And so that your DNA code can be expressed many different ways. And the environment plays a big role in how those genes are going to be expressed. So that means that, like, simple examples would be like, well, you have two twins and they have the same DNA, but they're not exactly the same because the way their genes are expressing themselves, even though they have the same exact DNA code, it's slightly different because of the environment and all the different factors that influence them individually in their lives. So that's an epigenetic, would be the differences between two twins. How come they don't look exactly alike? Then you have epigenetics. I use it like the example of they have all the same DNA code is the same code that makes your red blood cell and also let's say your neuron, in your brain. And so that actually they have the same DNA exactly, but they're programmed differently. So the way the genes are expressed, it actually leads to this fully different cell type. And that stabilizes, that stays like that. That can be programmed and locked in. And so then now that red blood cell is going to be a red blood cell until it dies, and same with the neuron. But then as we learn about how to manipulate these things, we find out that you can harvest some cells and wash away some of that epigenetic programming and make a stem cell, go backwards and make a pluripotent cell. Like I say, like Etch-a-Sketch, you just Etch-a-Sketch it, wash it out, and now you have a pluripotent cell. And that's how they made the first sheep clone. They took a mammary cell from the mammary gland. They washed out, with the chemical process, the programming, and were able to expose the pluripotency of that cell and now make a whole sheep again. So it's this epigenetics is like this new area of biology where we're learning how dramatically variable and versatile DNA expression is. And so it's a big deal in biology and medicine because there's a lot of diseases that you would see somebody and think, well, that's probably genetic, but then it might be epigenetic. In other words, it might be just something that was accumulating in the system that hasn't really changed the DNA code. So it's like software, not hardware. And the reason that's a big deal is because, well, maybe we can fix the software. And we don't have to do, but there is such a thing as fixing the hardware now. They're investigating that, right, with CRISPR and DNA code manipulation. But in some cases, that's not really where the problem even lies. Let's say if sickle cell anemia, they know, this is a mutation in the DNA code. But when you have something like diabetes type 2, where people are developing this disease over the course of their lifetime, they might have some genetic susceptibility, but it's definitely their nutrition and their lifestyle are having major effects on the way the genes are being expressed. And then when we see it accumulate in generations where they think, well, this diabetes type 2, but my mom had it, and this person had it, and that, my grandma. So they figure it must be genetic. But then you see it like accumulating. Now the child is getting it at a younger age than the adults got it, which is, we observe that right now with type 2 diabetes. Children are getting it, and the adult didn't get it until they were 45. So it's not quite as simple as just saying it's genetic. So then it looks like it's very epigenetic. It's the way the lifestyle and the nutrition and pharmaceuticals and everything else affect the coding of the genes. The machinery, the biochemical machinery that surrounds the genes, that is like the interface between the DNA code and the rest of the cell and the rest of the world. So there's other areas, diseases that are looking like epigenetics plays a major factor, major role. One of them is cancer, which makes a lot of sense. So you might have some gene, you might have some tendency to cancer, but why do some people flip into cancer and others don't? And it's because the regulation of those genes becomes disturbed by some kind of carcinogenic process. So cancer is the new area of seems very epigenetic. The other autoimmune disease of all different kinds has been examined. Like, how come these people, they have the tendency, but not everyone gets it. And then we know these other factors make it worse. So that's autoimmune disease. And then the last on the list that's interrelated is mental health. So depression, anxiety, PTSD, even addiction, like there's a growing body of evidence. There's this epigenetic process happening. So that possibly like a childhood trauma could lead to some kind of epigenetic change and system of this child, and become, let's say that's happening during a process of emotional development. Like when the child's biology, their emotional biology is developing, the way their attachment is going to be, just the way it happens, that somebody has this secure attachment or this insecure attachment, their attachment style, how it's related to their caregiving that they received, or neglect or abuse that they may have received, and how that during that window of time, that kind of tagging that would happen to track at the epigenetic level, like responses to stress, would be possibly stabilized. And so childhood trauma issues that affect them at an epigenetic level would kind of follow them throughout their whole life, and that they would be biologically predisposed to having some other health issues, because of the way their cortisol receptors work, because of this trauma. I mean, there's some speculation, but it's all kind of adding up to look like it's something like that is going on. And so the question is, how could you then, like a PTSD, a PTSD from Vietnam, that these people are like that for decades, and then they have some kind of profound healing experience, and then they get better. And it's like, well, why was it so stable for so long and affecting them like at a physical level, where they're having their heart rate and their blood pressure and the reactivity of their nervous system and their cortisol levels and the inflammation in their blood is really reactive. And then they have this profound healing, and then all of a sudden that changes. So and we see that kind of, so when we see down in Peru, and I describe, and it's not like every case is a miracle, but, I put down some of the positive cases and some of the not so positive, but kind of show people what might be possible. And some of them had really dramatic shifts. And, like in the case of the migraine patient, which is the one that I used to talk about the story, I was going through my training in the shamanism and the curanderismo and the Shipibo style, where we sing to people, Icaros, in a form of like energy healing, in a form of support to try to help them through their process in the ayahuasca. And a lady was having a really hard time. She was a lady that had a migraine problem. And she had really severe migraines that were worse with her menstruation. So every month it was debilitating. Can't work, can't do anything, needs a lot of medication to get through it. And she came, and she was there for 10 days, and she had a really dramatic shift in her migraine symptoms that still, I just talked to her cousin, like this was years ago. I talked to her cousin last week for the holidays, and she continues to do well. So she had some dramatic shift. Migraine is there. When we talk about what's all in your head, you could easily try to dismiss the suffering of a migraine person. They're starting to measure stuff in migraine sufferers, but for a long time, it's kind of difficult to assess, what's really going on in there. But anyways, there they are suffering. And if you care about them and you trust the person that you care about, you realize, wow, something really serious is happening. So she is a migraine sufferer, and she was realizing while she was there something that I hadn't, I had observed in some of the other people. And I'm not saying this is true in every migraine case, but when you live with the patients, and as I did at the center, you hear a lot more of their story. A lot of the migraine cases were like they had been through a lot of yelling and intensity, screaming, aggression when they were children. And like this idea of their senses being overwhelmed. And this like sensory integration process that is a migraine, where certain smells throw them over the edge, or certain sounds throw them over the edge, or certain lighting throws them over the edge, or hormonal disturbance, like with a menstrual cycle. So I asked her, is that your story? Because I've been hearing this and I'm just curious. She said, yeah, her dad was this big time rager, like throw the, food off the Thanksgiving table and flip the table and, really scare everybody, and then be really gentle and sweet other times. So it was like walking on eggshells, trying to figure out how to get love from this man. And so she went through a lot of that. And then in her ayahuasca ceremonies, she did have a lot of severe headaches during the ceremonies. And then initially, that was pretty tough. But it was a lot of like energetic purging of all this rage. And then her own anger. And then she had to learn about how to forgive her father and accept him for who he is. Those are like the that she went through that were connected to this improvement that she had. So one night she was in the middle of all that, and she kind of like plopped down in the middle of the maloca, the ceremonial space, she was overwhelmed by the ayahuasca. She just had to sit down, and she came back from the bathroom. She didn't make it back to her mat. And so she was kind of in the way. So I had to go like try to get her to move back to her mat, but she couldn't. She was unresponsive. She was breathing. She's sitting, but she can't talk, and she couldn't move. And so she's just really deep in the ayahuasca, and so it's like kind of hard to deal with her. She was quiet, but somebody's going to trip over her in the dark as they go to the bathroom. So to try to help her, then the way we do it there is like when I realized there was no communication, well, then we sing. We sing to the person, ikaro, the traditional healing like technique, to try to help, partially center her, bring the ayahuasca down, the effect, help her come back to her senses a little bit and strengthen her mind again. And so kind of go through that process. But on the way there, yeah, also like the training is also you have a visionary experience. And so if you see things, then you try to clean those things energetically, with your imagination and with the song. And so then I was singing to her. I was shown in the ayahuasca in my visions. I saw this like pink chromatin, like the chromatin is the DNA wrapped around protein packaging. And it is DNA has to wrap around these proteins to get packaged in the cells because it's all this whole long, magical, sacred geometric thing. And so I was showing me the chromatin, like it was like this pink glowing balls floating and with the DNA mixed in. And then I could see that there was like this dragon, this little black dragon swimming through the nooks and crannies of the of the chromatin, because it has all these little crevices, and these little spots, like a 3D biochemical model kind of thing. And so I'm seeing that, and then I'm watching this little dragon, and then the ayahuasca tells me, I just hear a voice, or this is how it comes to me. It's like, Joe, her problem isn't in her genes, it's on her genes. She's like, oh, I got migraines, it's genetic, I must have from my family or whatever. It's like, no, it's on her genes. This is like it's epigenetic. That's what epigenetic means, is upon the genes. So then that's what really got me very curious. And so then I started doing, I looked up some papers on migraines, and because I had never, as a doctor, I had not been told once, in medical school, that migraine might be related to childhood trauma. It's just basically seen as this freakish tendency of a person, And so then I started, there are papers about that. There is research where people said, yeah, childhood maltreatment, may be related to migraine syndrome. And then I was like, well, what about this epigenetics? And I found a few papers around epigenetics and migraine. And so I was like, oh, wow, that's interesting, because that was really from that vision that I even investigated that. And so then I started investigating epigenetics and trauma as it was related to the other problems that I presented in the book. Because the cases in the book were just based on some really significant medical cases. So a depression case, Crohn's disease case, like I mentioned, a PTSD case, an addiction case, even this chronic cough case that I brought in there, the chronic pain cases, the anxiety stuff. So all that kind of stuff. And as I was researching those patients, I was like, yeah, each one of them had all this trauma healing that happened. And then in each one of those conditions, there was significant epigenetic research to say, hey, it looks like the epigenetics plays a big role in each one of these problems. And that would be the connection to the trauma. So it's just about this emotional biology and the emotional biology of trauma and how do we heal that. And so that's how I got into it, was from my experience with ayahuasca. And then the research kind of supported that and other people's ideas. And I started talking about it. At the MAPS conference, I gave a talk on this in 2013. And, a lot of people were like, wow, what are you talking about? But there were a few people that were like, yeah, that makes sense. And they also were thinking along those lines. And now epigenetics and trauma is a really hot topic. And epigenetics and trauma, as it might be related to psychedelic medicine, is a really hot topic. And so a lot of people want to do that research right now, including us, which is what the Modern Spirit Epigenetics Project is about. But, you need money to do the lab stuff. And that's why you don't see more of that research happen, because it's expensive.
Mm-hmm. Can you tell us a little bit more about your research project in conjunction and collaboration with MAPS?
Yeah, so that research project is called the Modern Spirit Epigenetics Project, and is USC, so MAPS. So MAPS has been very gracious. The Multidisciplinary Association of Psychedelic Studies, who's running this really groundbreaking research with Mdma-Assisted psychotherapy for PTSD, getting these big results that I mentioned. So there's a group of people that kind of initiated the idea. We just had a little phone call earlier today. David Rabin he was previously at University of Pittsburgh, Ben Kelmendi from Yale, psychiatry, and my friend Rael Khan from USC, psychiatry. So we have been talking. We wanted to do a study about ayahuasca initially, because I was in that field. I am in that field. But it was getting difficult to try to coordinate all the samples and do all that stuff in Peru. And then meanwhile, David had been working with MAPS, Rael had been working with MAPS, and had some relationship with MAPS. I was curious about MAPS. And so we approached them to see, well, what if we did this epigenetics analysis of your PTSD study? So they're open to that. So they're providing all the samples. So not everybody, but some of the people going through the study, they give saliva samples like you would give for like Ancestry.com. And then those are collected. And then those are going to be analyzed. We have 29 sets so far. And we're probably going to get about, so we're waiting a month for more people to go through the trial. And then those will be analyzed by a lab. We're talking to a few different labs. The primary analyzer that we talked to is Candace Lewis at ASU at this TGen here in Arizona. And so then they would analyze that, and we would try to see if we can see that if these people had a really profound healing, can you see changes at the epigenetic level? That would be that you could link to prior trauma, or in this case to their PTSD trauma source, whether that's combat or sexual abuse or whatever it is. And so there's research around PTSD and epigenetics, and there are certain gene areas that have already been identified where you could show some disturbance, in the cortisol receptor and genes associated with that, and other little regions of the DNA where you can show how trauma affects the epigenetics of those regions. And there's even some little bit of research around how psychotherapy can cause alleviation of the problems in those regions epigenetically. So we would focus, then the analysis is like still in development because we still have a few months, but it'll be a combination of looking at like whole shifts in the epigenome and also gene regions, looking for signs of like where the trauma healing affected them at that level, near genetic level, very core biological level, which might explain like the stable shift that we see.
Mm-hmm. So you have specific gene markers that you are already targeting to look at.
Yes.
Okay.
Specific regions, areas, So so this would be like a huge breakthrough, because it's like then it would open the door to showing how this thing that we were talking about earlier, that the emotional healing is something you can't really measure. So why don't we just blow it off? Who cares? But if we can show that actually this trauma that this chronic pain patient is telling you about is affecting them at an epigenetic level and it's real, and if we do this kind of healing with them, we can really change that, then that really changes the whole issue in the society, because like how we started this conversation, that the materialism that drives the society is what's blocking us from looking at some of this, this more invisible stuff. But if the epigenetics is a place where some of this invisible stuff, we can show evidence that that's where it is measurable. And that's like in the case of emotional trauma, there is an argument there that emotional trauma does live on in the epigenes. And so then now all of a sudden it kind of opens the metaphysical discussion, but it allows us to start looking at healing at this kind of level. And you could use that to try to assess, hey, is this energy healer, or is this other form of healing, or is this prayer, or what is this? All these different modalities, positive thinking, meditation has been shown to lead to epigenetic changes and makes them a very real, those interventions or even meditation or those practices become a very real influence on emotional biology and on medicine and health. And so then now, should Mdma-Assisted psychotherapy be covered by insurance? Well, let's say and we don't know that we're going to prove this, but let's say we show that it causes an epigenetic shift, and you can show that these other rehabs are not doing that. These other centers where they're charging people a lot of money, but they're not affecting this core level of change, then maybe the money should go over here. So it has very real implications of, and again, we may not be able to prove it. We may not be able to show anything. So we're going to find out, but there's reason to think there might be something there. And so, ultimately, like the catchy way for me to talk about it is like, we're trying to see where spiritual and emotional healing touch the flesh. And that would kind of open the door to a more sophisticated culture that would be able to address, some of the things that we started this conversation, be able to talk about those things in a more clear way.
Right. Well, this has been a fascinating conversation. Now, if people wanted to learn more about your project or contribute in some shape or form, what's the best way to get in touch with you, and can you give us some more information?
So they can, modernspirit.org is the easiest way to learn about the study. The crowdfund is accessible through modernspirit.org. It's managed by CrowdRise. And then you can learn more about me and my work at drjoetafur.com. And those are the two main ways. So, if anybody wants to support us, it would be to do all the things we just talked about. That's what we're trying to achieve.
Perfect. And we'll put that all in the show notes as well. Is there any closing remarks you'd like to share with the audience?
My closing remarks are just that, thank you for listening. Thank you for being interested and curious in this topic and this subject matter. And just, I think it's just so important right now. We're learning so much in medicine about the importance of trauma healing and the importance for our culture. And so I just encourage people to explore that in themselves and with their families and in healthcare.
Well, this was a fascinating conversation. We look forward to perhaps picking up the conversation at a later date when you have some results. And thank you again for all your time. Appreciate it.
Yeah, thank you too. Thank you very much.
Bye-bye. Thank you.